Question for today is a 48-year-old female presented with menorrhagia since 3 months. On examination, the abdomen was enlarged up to 10-week size. She underwent hysterectomy and the gross examination showed a tuberculated appearance and biopsy showed presence of endometrial glands deep inside the myometrium. What's your possible diagnosis? Endometrial adenocarcinoma, leiomyoma, adenomyosis, or endometrial polyp. Now look at this question. It's a middle-aged female with menorrhagia with a uterine mass which is probably showing a tuberculated appearance, and the biopsy finding is showing glands in the myometrium. So this is how a uterus looks, and this is cut open like this and it's open like two halves. So what you're seeing here is this is the myometrium, this is the endometrial cavity. So this is your endometrial cavity. Okay, so it is thickened. The myometrium is usually not this much thick, so the myometrium is thickened. So in addition to this, what do you see? You can see some dark hemorrhagic spots here. So whenever you see a thickened myometrium with hemorrhagic spots, always think of one diagnosis, which is adenomyosis, Now what is this image showing? Here what you are seeing is glands. You see a lot of glands here like this, and they are present in the spindle cell stroma, that's the myometrium. So you have glands in the myometrium, so it's quite typical of adenomyosis. So if you have endometrial glands in the uterine wall, especially in the myometrium, we call this as adenomyosis. So suppose, let us imagine you have endometrial glands not in the myometrium but somewhere outside the uterus, then we call it as endometriosis. Okay, so imagine this is the uterus. Here you have endometrial cavity, you have fallopian tube, you have ovaries. So if you have these endometrial glands which are supposed to be here, present here, this we call it as a adenomyosis. Suppose if you have here the endometrial glands, this we call it as endometriosis. Okay, so what's the diagnosis here? It's undoubtedly a adenomyosis. So let's see about other options. If you have an adenocarcinoma, your endometrial cavity will be filled with an irregular shaggy mass, okay, or a fluffy endometrium which is very thick and irregular. Of course, your histopathology will show atypical glands. When you take a leiomyoma, so remember leiomyoma is nothing but what you call it as fibroid uterus. So there will be a circumscribed mass usually. See, you are able to draw a circle. They can be of any type, intramural, submucosal, but it will be forming a well circumscribed mass. So look at these two images now, adenomyosis and leiomyoma. You can never see any well-defined masses. Can you draw a circle around any mass? You can just see that the myometrium is thickened, that's it. You can't form any well-defined mass. Usually you don't see, okay, but sometimes you get to see. But leiomyomas are usually a very well circumscribed masses. Okay, so that's about leiomyoma and adenomyosis. Whereas endometrial polyp, if it is present, imagine it's the uterus and this is the endometrial cavity. Your polyp will project like this from your endometrial cavity. So I hope it's clear. So this is how a leiomyoma appears. You have a proliferation of spindle cells, and this is the circumscribed margin of the tumor, and these are all spindle cells. So to summarize, so when you have endometrial glands in the myometrium, we call it as a adenomyosis. When you have endometrial glands outside the uterus, we call it as endometriosis. And if you have circumscribed masses, it's usually a leiomyoma, or if you just have a myometrial thickening with tuberculated appearance, it is adenomyosis. So this is about the gross and microscopy of adenomyosis and leiomyoma. Thank you.